Hi, I'm Diane DeStefano, nurse practitioner in Grayville, Illinois with Wabash General Primary Care. And every year we celebrate women's heart health in February. It's National Wear Red for Women, Friday, February 5th, 2021, and I'm looking forward to it. Each year, the American Heart Association celebrates Heart Month in the uh, month of February, and there is a wave of red from coast to coast. Are you aware of what causes cardiovascular disease in women? What about the survival rate, or whether women of all ethnicities share the same risk? The fact is, cardiovascular disease is the number one killer of women, causing 1 in 3 deaths every year. That's approximately one woman every minute. But it doesn't affect all women alike, and the warning signs are different. They're not the same as in men. What's more, these facts only begin to scratch the surface. There are several misconceptions about heart disease in women, and they could be putting you at risk. The American Heart Association's Go Red for Women movement advocates for more research and swifter action for women's heart health for this very reason. Did you know that more than 2,200 Americans die of heart disease every single day? That's one death every 39 seconds, and on average, someone in the United States suffers a stroke every 40 seconds, while a stroke-related death occurs about every 4 minutes. The American Heart Association has spent more than $3.3 billion on research and is increasing our knowledge and understanding about heart disease and stroke, also making the AHA the largest funder of heart disease research, second only to the US government. There are many forms of heart disease: problems with the arteries, problems with the valves in the heart, problems with the heart rhythm, problems with the muscle function of the heart caused by one of the above, coronary artery disease or coronary heart disease is the most common. Heart disease develops over years and progresses when the heart doesn't get enough nutrient-rich blood and oxygen. It may not be at the top of your list and most women's to-do list, but caring for your heart through a healthy diet, regular physical activity is the secret weapon to preventing heart disease. While many assume that popping a few pills that your healthcare providers prescribed is enough to quell the symptoms or prevent a heart attack, the real prevention power lies within you and real changes to your lifestyle, which can reduce your risk for heart attack or stroke by as much as 80%. Do you know your risk factors? Ones that you can change include physical activity, decreasing stress level, and that's kind of difficult in this pandemic, high blood pressure, obesity, diabetes, high cholesterol and triglycerides, smoking, unhealthy diet. What can't you change? How old you are and your family history. Did you realize that risk factors, if you have one risk factor, it doubles your risk of heart disease or stroke? If you have two risk factors, it quadruples your risk. 3 or more risk factors can increase your risk more than tenfold. So let's do something about your risk. Exercise is the key. Exercise helps you lower your blood pressure, it helps you prevent diabetes, it lowers your bad cholesterol, the LDL, and increases your good cholesterol, the HDL. It helps you manage your weight, and also it gives you good endorphins to help you manage your stress levels. All around, exercise is the key. Our bodies are meant to exercise. Check with your provider before you start a strenuous exercise regime. Then go for it. At least 40 minutes of moderate activity most days of the week. Just get out there and move. More is better than less, and strength training plays a big role in helping you prevent heart disease. Do you know your numbers? Your blood pressure should be around 120/80 or less. Your bad cholesterol, the goal is 100 for most people and 70 for diabetics. Your HDL should be at 50 or above. Your triglycerides should be below 150. Your BMI should be 18.5 to 24.9. Your waist for women should be less than 35 inches and 40 for men. And if you have diabetes, your goal for your A1C should be 6.5 to 7. As we get older, high blood pressure is very common. Even people who had good blood pressure all their lives are at risk for high blood pressure as they age. High blood pressure is called the silent killer because it doesn't have any symptoms. When you lower your blood pressure, good things can happen. Your stroke risk is reduced by 40%, heart attacks by 25%, and heart failure by 50%. What can you do to lower your blood pressure? Well, make healthy habits. Take a 30-minute walk every day. Avoid being overweight. Lower salt in your diet. Follow a heart-healthy diet, including low fat, lots of fruits and vegetables and whole grains, and low-fat dairy products every day. There are many good and safe medications, but follow your provider's recommendations and prescription. Most people will need more than one to control your blood pressure. What can you do to lower your cholesterol? Our treatment goals now are based on your personal risk. Healthy behaviors are important. If you already have heart disease or diabetes, or if your cholesterol level is high and your risk is high, you will need medicine to help lower your cholesterol. Limit your saturated fat to less than 10% of your total calories in a day. Replace saturated fat calories like butter or cream with unsaturated fats, which are healthy, like olive oil. Polysaturated fats, sunflower seed, grapeseed, and flaxseed oils. And new evidence shows that saturated fat intake, not cholesterol intake, has as much greater impact on blood cholesterol levels than we thought. You should know the main 4 symptoms of heart attack in women. Of course, the first one is chest pain, chest discomfort, heaviness, tightness, feeling like an elephant is sitting on your chest, pain or discomfort in one or both of your arms, shortness of breath, sweating, nausea, and dizziness. In surviving a heart attack, minutes matter. Know your warning signs. Call 911 immediately because fast action saves lives and muscle. Emergency medical personnel will begin your treatment right away. Do not drive yourself to the hospital. Uncertainty is normal, so don't be embarrassed if it's a false alarm. Plan ahead by making a heart attack plan with your healthcare provider. In this time of pandemic, COVID-19 can impact your whole body, including the heart and blood vessels and brain. We know that during the severe COVID infection, heart function may decrease. Sometimes this decrease is a consequence of the systemic inflammatory response to the infection, and occasionally in some people because of direct viral infection of the heart muscle itself. Heart failure can develop due to the systemic inflammatory response to the infection, high lung pressures from lung damage, or from heart inflammation known as myocarditis. There are 2 dominant cardiac issues related to COVID-19. Heart failure, when the heart muscle doesn't pump like it should, and arrhythmias, or an abnormal heart rhythm. That can be related to the infection or the effect of the medications used to treat the disease and the virus. Researchers are starting to study the long-term effects of COVID-19 at both the population health level and the individual level. Funding from the American Heart Association and the National Institutes of Health is spearheading research related to COVID-19's cardiovascular impact. We know that this is a stressful time for everyone, especially because of economic and social impact of this disease. even if you don't have it yourself, and that can still put people at a heightened risk for all sorts of stress-related diseases. For those with known heart issues, whether high blood pressure or other disease, stay focused on good heart health practices. Take care of yourself. Be vigilant with your hand hygiene and trying to maintain an exercise regime, even if you're stuck at home. Eat well and try to maintain your health as best that you can. So, key takeaways from our talk today: know the symptoms of heart attack and stroke, know your risk factors for heart disease, work with your healthcare provider to reduce your risk, avoid smoking and tobacco products and secondhand smoke, have your blood pressure and cholesterol profiles measured, and your blood sugar if you're at risk for diabetes. Follow their advice to manage your risk and healthy behaviors and make healthy changes. Take medicine if it's needed. Eat a heart healthy diet, low in fat and salt, and lots of vegetables and fruits. Exercise, walk at least 30 to 40 minutes each day. That would be perfect. Manage your stress in the most stressful time. And keep in touch with your healthcare provider, either through visits or we now have telehealth. Have a heart to heart talk with your provider about your risk for heart disease. Prepare a list of questions before your visit. Write down what the healthcare provider says so that you'll remember later. And tell the healthcare provider about lifestyle behaviors such as smoking or being physically inactive. And also, please let us know if you test positive for COVID-19.